Fox 4 is working for you, pushing for answers surrounding what could be a public health concern that you need to know about. We're talking about a potentially deadly infection caused by an amoeba.
Yes, it has turned up in Floridian waterways and many times before. And while a local family claims a young boy may have been infected at a Charlotte County beach, it has been difficult to get information or confirmation from the state and local health officials about whether this freshwater amoeba is to blame here. That is where Fox 4's Caitlin Knapp has been vetting this story for you for the last 2 weeks now. Caitlin, what have you found out?
Well, a lot of work going into this story today, Chris and Nadine. I wanted to really make sure that we were accurate on this story before telling you at home about a public health risk in our area. And when I first contacted the CDC, state and local health officials a week and a half ago, state and local health officials told me there were no confirmed cases of the amoeba called Naegleria fowleri. The CDC said they were looking into it. Fast forward to today, the Department of Health gave a last-minute educational presentation at the Charlotte County Board of Commissioners meeting, which had me asking more questions.
We've been aware of this individual that's been on social media for quite some time. I'm not at liberty to discuss out of respect to privacy for that family.
That's all the Department of Health would say about whether a boy was infected with the potentially deadly amoeba in Charlotte County. This despite a family's claims on GoFundMe and Facebook that a young boy likely became infected at a Charlotte County beach in early July and remains in a hospital. Commissioner Joseph Teseo said he knew the family.
I know him and his family, came up with my son. They're approximately the same age.
Today, I emailed and called every health agency, CDC, state and local health departments, asking whether any tests were conducted.
Good morning, this is Caitlin Knapp over at Fox 4 in Fort Myers.
None of them responded, but here's why I keep asking questions. In a post on Facebook from July 17th, the boy's aunt claimed that samples were sent to the CDC, but those samples did not come back positive or negative. 6 days later, a Charlotte County spokesperson stated there was no confirmed case of the amoeba in Charlotte County. We've yet to hear back from the health department, but their presenter offered this up to Charlotte County leaders today.
We're notified even when it's whenever a physician moves to test. And then from there, we work with the CDC, our labs, those physicians, and really try to rule out any other possible case or definition.
Regardless of whether a test was conducted on the boy, we also learned a test would not be conducted on any bodies of water.
And then testing of the fresh water is not recommended by the CDC because amoeba is naturally occurring, and there's no established relationship between the detection or concentration of Naegleria fowleri and the risk of infection. Just assume that Naegleria is in fresh water, and so that's why the testing component isn't there as well.
While we don't know 100% if it's this amoeba, certainly some of the symptoms, point that way.
Now, a few more things with this amoeba. It is extremely rare. The CDC has only reported 154 cases since 1962 with only 4 survivors. The only way to become infected is if the amoeba enters through the nose, such as when water splashes and goes up your nose or just jumping in the water. And Chris and Nadine, I'll continue to monitor this situation so our viewers can get an accurate picture of whether this was truly an infection caused by an amoeba in our waterways. Live in studio, Caitlin Knapp, Fox 4.